how do you view the system in terms of how it's functioning, how it's not functioning well? I would love just like your high level picture of the system.
Well, the system attracts really good people, but it is entirely broken. It's stagnant. It's got a culture of its own that preaches obey, memorize, do as you're told, don't think creatively in subtle ways. The way certain research is funded, other research is not funded, big ideas are ignored in place of small incremental steps in research that really have not delivered for us. You look at the tens of billions of dollars we spend on cancer. What have we gotten for it? A very low ROI. Chronic diseases are going up. We don't talk about food as medicine, self-awareness, communication skills, listening to patients. The sort of person that goes into healthcare is an incredible person. The sort of kid in high school that is asked, hey, what are you going to go into? And they say, thinking about being a nurse. They're different from their peers. Every single human being in the healthcare world, hospital administrators, everyone is in it for one reason, out of a sense of compassion. They want to help other people in need, or they want to contribute to that idea. I think we take these creative, bright, altruistic young people and the culture of medicine through its training and its own norms and values, beats them down and turns some of them into robots, burns them out, where you're told to kind of bill and code, for everything as a doctor. And you get on this hamster wheel and you sort of lose sight of the essay that you wrote to get into med school, where probably those essays, I'm at the Johns Hopkins Medical School, of the students that come in, 90% want to do medical missions either as full-time, which is a small fraction, or most want to do it in some part of their career or practice. And a lot of that great vision, that mission of why we go into medicine gets beat out of us by the system.
How do you, so you're a professor at Johns Hopkins as well. How do you teach that to your students as they're entering? Because I imagine the students who are walking through your door are bright-eyed, bushy-tailed, ready to take on the world, and still haven't really fully seen the inside of the beast of what the medical system really looks like.
A beast, yeah.
So how do you teach that to them, knowing what the system is?
So there are great mentors in medicine. There are great professors at Johns Hopkins that they should be learning from. But I think they come in with the big ideas. But we kind of tell them, well, you have to pick an organ. Here's the anatomy textbook. Here's a picture of all the organs in the body in the Frank Netter Atlas. Pick which organ is going to be your organ because you have to have one for your life. And it's like, that's not really a great message. What if you're interested in the whole person? What if you're interested in how we deliver care, how broken it is that we have this model where people come in and we tell them, eat better, exercise more. We don't even tell them how to eat better. We give them misinformation. And then come back in 6 months with these medications and check back in. And then they come back in 6 months and we tell them, you're a bad, non-compliant patient. And it's like, this system's broken. The patients hate it. We hate it. We're doing short 15-minute visits. Now, I'm a surgeon, so it's a little different. But this whole primary care interface now has a revolution where doctors are saying, I don't want to be on that hamster wheel. I want to go deep. I want to understand things that we're not taught. Like the role of general body inflammation, the role of toxins, environmental exposures that cause cancer, not just the chemo to treat it. There's a generation of students and doctors out there right now that are saying, can we treat more diabetes with cooking classes than just throwing insulin at people? Can we treat more high blood pressure with talking about sleep quality and stress management instead of just throwing first line hypertensive after second line? Can we treat more back pain with ice and physical therapy, not just surgery and opioids? Can we talk about food as medicine? Can we not just talk about treating kids with Ozempic? Can we finally talk about school lunches? This is a revolution in medicine that makes me very optimistic, and it's what I describe in the book Blind Spots. It's an effort to say we've got the most medicalized generation in the history of the world. we've got to try something different.
Mm. When do you think people started waking up to this revolutionary idea that we need to really create some change here in the medical system?
I mean, I think you look at the graphs of chronic diseases and you're like, we're doing all this stuff. Healthcare is now the largest business in America, bigger than any other sector. What are we doing? I mean, we're not exporting anything really in this sector. We're providing services on our own people. We've got everyone on, the average American is on 4 meds. The average senior is on more than 6. Chronic diseases are getting worse. And yet we've got these blind spots, these things we never talk about. Food, general body inflammation, the whole lipoprotein world. We've created this simple, moniker of HDL is good cholesterol, LDL is bad. Well, it's much more complicated than that. And we can be teaching those basic principles in a way that people can understand them. For example, everybody should get an Lp(a) test. Everybody should get an apoprotein B. I would say if they're over 30, you should get an apoprotein B. Lp(a) you can get at any time. But next time you get a blood test, those are 2 tests that are very good, or at least better predictors of heart disease than all the other stuff we've been testing for.
It's so interesting. I feel like a lot of people have woken up, especially in the past several years, and maybe COVID gets some credit for it, but just a shift in thinking has happened. The paradigm has, I think, been broken, the old paradigm that we were living in. And now a lot of people who have been in the medical institutions for a long time, teaching, practicing, are hitting the pause button and saying, hey, are we really doing what's best for our patients here by prescribing away every single illness, or should we be focusing more on the preventative side, which is something you talk about in the book quite extensively. It's layered in there. So I'm curious, how do you think about starting to make some of those changes and reorienting the system?
It's tough, but enough docs and healthcare folks and people adjacent to healthcare professionals, people like yourself, podcasters, are out there now saying, hey, wait a minute, we're converting America's children into a generation of patients. We're assigning diagnoses to them that are just part of ordinary life. If you're nervous before taking a test as a kid, why would you tell that kid you have anxiety, like assign them a chronic disease?
It's a good sign. If I've noticed
Right.
that every time when I feel nervous, it's a sign that I'm being pushed into being pushed. I think, and obviously that's one example of anxiety, but I think it's a good thing.
Yeah, I mean, there are boundaries of what's normal, and there can be extremes. But we've used to have sort of extremes in patient presentations and childhood mental health presentations, where you'd say, yeah, this is clearly a disorder. But now these diagnoses are getting slapped around like crazy. Sometimes it can become a self-fulfilling prophecy. And so, who's gonna blow the whistle and say, hey, wait a minute, we're soon going to have every 6-year-old in America on 3 medications. Like, somebody has got to say stop. Is pharma going to fund the research to say, hey, what's, how can we promote communities to address depression instead of throwing antidepressants at people? By the way, I notice your mic is drifting. Is that
it's drifting a little
creating
bit.
Anxiety for you?
A little bit. I got to keep the hand there to support it.
Nice.
I'm curious, have you studied much of the medical history around when things started to change? Because there were certain points in time where we weren't as sick, where chronic diseases were not as common. So when did things start to change?
So it's fascinating. I did study this and wrote about it a little bit in the book Blind Spots, because modern medicine has huge blind spots. And my interest, my research team at Johns Hopkins, the book Blind Spots, has always focused on the big topics in medicine that we are not talking about that we should be talking about. And there's a lot of them, and we've mentioned some. But this whole modern era of sort of the unquestioned authority of physicians, what we call the white coat era of medicine, started after World War II. Because before then, we didn't really have a lot we could do as doctors. When we had a lancet, we'd like take some of your blood out by inducing a cut and just try to bleed people.